Hey guys, Davin Lim, board certified dermatologist. Today's video will be talking about an old technology known as HIFU, or high intensity focused ultrasound. This device, also known as Ulthera, Ultherapy, or in some countries Ultraforma, is basically focused ultrasound. It's been with us for the greater part of 12 to 14 years and is used by many countries and many clinics. Now, the problem about this device is that it's being used throughout the entire world for the treatment of certain things like skin laxity. Because it's not a laser, it can be used by basically anyone. So the regulations around HIFU, at least in Australia, is not that stringent compared to something like a laser device. Now, the problem with HIFU is basically three things. Number one, it hurts. Number two is that the results are variable because it can cause some fat loss, which I'll go through shortly. And thirdly, the pricing. Because there's consumables involved with each cartridge, the treatment itself can range from anywhere between $1,200 all the way up to $3,000 to $4,000. Now, the problem with all skin tightening devices is that the results are variable. So this video basically will tell you why they're variable and how to choose a skin tightening device based upon your concerns and your skin laxity. So let's talk about how it works. So high intensity focused ultrasound basically produces ultrasound energy, which causes vibrations, and this vibrations causes heat. And heat, as you know, denatures collagen, and when you have denaturation of collagen, basically two things happen. You have the immediate collagen skin tightening, and hence people feel firmer the day of the procedure, and you can have a delayed effect whereby with enough heat it can stimulate something called heat shock protein, and this heat shock protein lays new collagen over a period of weeks, but most frequently months. Now, how it works the second way is what companies don't usually tell you, and a lot of these companies, including the manufacturers of these devices, have basically denied this for over a decade, which is basically fat loss. Now, what happens is that with these energy levels, we can use what's known with the transducer, we can use what's known as an ultrasound to visualize where these energy levels are laid down into. So the common energy levels include things like, for example, 5.5 mil, 4.5 mil, 3 to 3.5 mil, and then all the way up to superficial 1.5 mil. Now, all of these depths basically differ according to which areas you're treating. For example, the forehead area, you may use this more superficial depth because the skin here is less deep compared to, for example, your jowls, and then the deeper areas which may need different transducers which go deeper, including a submental area, which may need transducers upwards of 5 to 7 mils. So all of these areas will have specific transducers in mind. Now, so we talked about how it works from your collagen stimulation. We talked about how it can help with fat. How it helps with fat is that if you use enough energy within the subcutaneous layer of skin, it can dissolve fat. Basically, it can cause what's known as apoptosis, basically heating of the fat layer, heating of the individual fat cells, with the resultant death of the actual fat cells itself. And the death of the fat cells basically gets carried away with your lymphatic system, and hence it can target certain key areas. For example, when you're looking at the nasolabial fat pads, your superficial fat pads, your jowl fat pads, it can't obviously target the deep fat pads because it's just too deep for the safety of this area. Now, you can also use that to target your adipose tissue, in other words, your pre-platysma fat, which can be targeted using things like CoolSculpting, cryotherapy, or even things like liposuction. However, with this device, you can cause collateral damage of the fat, but at the same time stimulate collagen, and hence why it's useful around the submental area, in other words, the under chin fat. It is also very good for sculpting around the jawline area. Now, these certain areas, for example, like fat reduction of your nasolabial folds, your deep folds over here, and your buccal, not buccal fat, but your buccal area. The buccal fat's a little bit deeper, but your jowl fat, for example, you can actually use a transducer to aim for that area. Usually speaking, you'll need between 2 to 3 sessions. It may produce an okay outcome with one, but most patients need 2 to 3, and it's usually spaced between 6 to 8 weeks apart. So that's the off-label use for this device. The big things that you guys want to know is that, first of all, is it safe? Which it is, if you know what you're doing. And secondly, who is going to respond, right? So how I explain to patients is this: not everyone will respond to non-surgical skin tightening. There's marked variation. So when you look at who's going to respond in the biggest response rates, your deep plane facelift is going to actually lift things because that's by far the best gold standard. Your other forms of facelifting, including your short scar facelift that repurposes or relocates the SMAS, is the second best. And then when you're talking about the dermal layer of skin, fully ablative CO2, laser resurfacing, and deep phenol peels are usually pretty good to actually lift the dermal layer and cause contraction. So when you talk about gold standards, that's that 3 or 4 treatments that produces the best, most reproducible results. Anything from there basically is, I guess, wouldn't say hit and miss, but you've got to actually have a calculated algorithm. So when do I use HIFU? HIFU I actually like using when there's mild to moderate laxity in patients with no sun damage. So when you think about logically, if you have sun damage, you basically have areas of collagen which are loose, right, in your skin. So as one ages, your collagen, instead of being, let's say like this, instead of being tight, becomes loose. When it becomes loose, you have skin laxity. Now, in laxity without sun damage, if you can imagine your collagen fibrils, instead of being tight, they're basically like this. And when we use non-surgical stimulating devices, or even things, for example, like radiofrequency, peels, laser, HIFU, we're tightening the collagen itself. Now, another scenario, when you have sun damage, basically you have what's known as elastosis. You have broken elastin and you have broken collagen. So instead of your collagen being tight or loose, it's basically broken. Once it's broken, the chances of contraction using devices, even powerful devices like radiofrequency or even HIFU, is much less. So for patients with significant sun damage, the chances of HIFU working is a lot less. Additionally, if you have, for example, heavy jelliness of your face and you're using the collagen stimulating rather than the fat breaking efficacy of HIFU, that collagen stimulation may not lift your entire area of both thickness of your fat layer, but also laxity of your dermis. So guys, all of these devices should be employed according to the patient's clinical findings. For some patients, the answers might be as simple as, for example, radiofrequency. In other patients where you want to break down fat and they've got mild to moderate laxity, you may want to use something like HIFU. When you have moderate to severe laxity, you may go for something like a facelift. While if you have compromised skin quality, for example, lax dermal collagen, but it's not only lax, but it's broken, you may want to consider things like deep phenol peels or ablative laser resurfacing. So guys, there are many ways to surgically and non-surgically tighten skin. And all in all, patients should be individually assessed according to their skin type, their downtime, their ethnicity, and importantly, their clinical findings and expectations. And the physician should have that face-to-face conversation with the patient to understand what they want and come up with an algorithm based upon all of those factors and not use one device. So guys, I hope you liked that video. It's a short video, a little bit abstract in regards to how to think about HIFU rather than what can a device do for you completely. Many variables, and that's what you should consider. Please like, comment, share, and subscribe. Catch you next week.